Active release techniques. Okay, that's a technique that was developed by Dr. Michael Leahy. It's aimed for sports mainly. It works with a lot of triathletes. It's very popular amongst chiropractors. Dr. Leahy himself is a chiropractor. He's a brilliant man. He actually, before he was a chiropractor, was an engineer, so he approached the body from an engineering standpoint. And he came up with active release technique, which is all about working the soft tissue to help release adhesions, which are just those muscle knots you get in there. These are things that build up from energy or from injuries. Okay, so active release techniques are about working on muscles to help remove scar tissue and knots that are limiting the ability of the muscle to function. That can shorten, restrict a joint, make the joint work not as well, and cause problems. So with active release techniques, what we want to do is go in there, get a hold of that little knot we find, which is just a little bundle of scar tissue that builds up from either repetitive stress or some type of injury from an athletic performance. Okay, so an active release technique practitioner is going to go in there, they're going to get a hold of that muscle, and they're going to find that knot, they're going to feel for it. That's what they're trying to do. They're going to pin it, they're going to shorten the muscle, hold it like that, and then they're going to have you stretch it while they put pressure and pull a little stretch into that knot. The whole idea is to break loose that scar tissue, free it up. Once it's removed, the body can then correct the problem correctly, so that you then have a more healthy muscle that's removed, or the restriction that's been holding it up. The joint moves better, it functions better. If you're an athlete, it's going to increase your performance, but it's going to help everybody, help remove problems, particularly people that work at desks that create carpal tunnel. That really, a lot of people with carpal tunnel try to get it done with surgery. You can really do it with other soft tissue techniques a lot of time as well and avoid the surgery. Surgery sometimes has to be done multiple times. If you're going to do a surgery once every few years, why not do active release every few weeks or every few months to help prevent that and not have yourself cut on. So active release can help a whole gamut of people, from the athlete to the normal person. It's a great technique. It's probably one of the most effective ones that I've learned so far.